In this video, you'll get a quick overview of Vibrant's Hormone Zoomer test. I'll explain the Vibrant advantage and the technology used. Then I'll walk through each section of the test, highlighting key features. I'll also suggest complementary tests, and end by summarizing the key takeaways and where to go for additional information. Hormones control many different bodily processes, including metabolism, homeostasis of blood pressure, blood sugar regulation, fluid and electrolyte balance, and body temperature. Also, growth and development, sexual function, reproduction, the sleep-wake cycle, and mood. When hormones are out of balance, this can manifest as fatigue and weight gain, poor stamina or poor muscle tone, osteoporosis, hair loss, hot flashes or night sweats, insomnia, low libido and infertility, menstrual cycle changes such as lack of periods, infrequent periods, heavy periods, or painful periods, and also emotional symptoms such as anxiety, depression, or mood swings. To help you identify the root cause of these hormone-related conditions, Vibrant's Hormone Zoomer combines evaluation of adrenal and sex hormones and metabolites alongside endocrine disruptors, bone health markers, and the oxidative stress marker 8-OHDG. The Hormone Zoomer will include adrenal hormones, diurnal cortisol, diurnal cortisone, diurnal melatonin, and creatinine. Also, sex hormones like estrogen and metabolites, progesterone metabolites, testosterone and metabolites, and also key ratios. In addition to the urinary hormone markers, the test also includes 13 endocrine disruptor markers, 2 bone health markers, and 1 marker of oxidative stress. Vibrant's Hormone Zoomer test is an easy at-home urine test. Patients collect 4 urine tubes, a first morning sample collected upon waking, ideally before 9 a.m., a second morning sample collected 2 hours after waking, an evening sample collected before dinner, typically around 5 p.m., and a night sample collected before bed, typically around 10 p.m. For full collection instructions, including things to avoid before collection, visit the collection instructions webpage linked in the video description. As for collection date, men and non-menstruating women may collect any day of the month. However, there are recommendations for cycling women. Menstruating women with regular cycles should collect during the progesterone peak of the luteal phase. This corresponds with days 19, 20, or 21 of a 28-day cycle, or about 7 days after ovulation if tracking. For longer cycles, add the number of days beyond 28 days. For example, collect on days 21, 22, or 23 for a 30-day cycle, and collect on days 17, 18, or 19 for a 26-day cycle. For irregular cycles, collect 5 to 7 days before expected onset of menses. And for postmenopausal women on hormone therapy, collect midway between doses. The Hormone Zoomer test also requires completion of the hormone testing questionnaire for more accurate results. For female patients, it collects information about their menstrual cycle, bone health, and toxin exposure, symptoms history, medical background, and treatment considerations. Please note that female reproductive health stage, i.e. pre versus postmenopausal, is a mandatory field as the reference ranges change based on the answer. Additionally, the questionnaire data is included in the final report for a more customized clinical interpretation. The questionnaire must be completed for the sample to be processed, and note that results cannot be finalized without it. Note there's a separate questionnaire for males which asks about bladder and prostate infection. Vibrant's Hormone Zoomer utilizes gas chromatography tandem mass spectrometry, or GCMS-MS, for quantitative detection of estrogens, progesterone, androgens, and metabolites in urine samples, and also utilizes liquid chromatography tandem mass spectrometry methodology, or LCMS-MS, for quantitative detection of cortisol, cortisone and metabolites, melatonin, endocrine disruptors, bone health markers, oxidative stress, and urine creatinine, as all results are normalized to urine creatinine, and more on this later. These are powerful analytical techniques that combine the separating power of liquid or gas chromatography with the highly sensitive and selective mass analysis capability of triple quadruple mass spectrometry. Before we dive into the actual report, I want to highlight that you get to choose how much information to include in the report you download for yourself or the report you share with your patients. You have 3 options: summary, interpretation, and all markers. I'll be going over the report that includes all three options combined, as it is the most comprehensive. Let's start with a quick overview. The Hormone Zoomer sample report includes a cover page, introduction, the questionnaire data, a summary with interpretive comments, graphs, and flowcharts, and then lists all markers. The cover page lists the sample type and the results interpretation key. The introduction page includes the methodology and interpretation of report, and I highly recommend reading this page, especially the part of the introduction where it says, reference ranges for each analyte have been established using a cohort of 1,000 healthy gender and menstrual phase matched individuals. And also the part where it says, the classification of red indicates a result that is outside the reference range, and the classification of green denotes a result that is within the reference range. The summary begins with the diurnal hormone flow charts and graphs. The upper left shows the brain signals that drive DHEA and cortisol production. That page also includes graphs of your patient's diurnal melatonin, cortisol, and cortisone levels. Green dots indicate results that are within the reference range, and red dots indicates results that fall above or below the reference range. Ideally, you want your patient's values to match the pattern of the light green shaded area. For example, cortisol should be highest in the morning with a peak after waking and lowest in the evening and night to allow you to sleep. The next part of the summary shows the values for all adrenal hormones, including deoxycorticosterone and corticosterone. These are both precursors to aldosterone, which offers insights into the renin-angiotensin-aldosterone system, or RAS, pathway function, stress response, and potential hypertension risks. And notice that all adrenal hormone markers are in range. After adrenal hormones comes the diurnal cortisol markers, giving you the actual values for each of the dot levels seen on the graph. And notice that nighttime free cortisol is above the reference range. Anytime a marker is outside of the reference range, the summary will show an interpretive comment about that marker, along with supplement suggestions. In this example, the supplement suggestions include magnesium, vitamin C, ashwagandha, and tangerine, a polymethoxylated flavone found in citrus peels. If available, you'll also see supportive supplement suggestions. These are supplements which enhance specific associated functions without directly influencing markers. The next is the diurnal cortisone markers. Notice that all cortisone markers are in the green and within the reference range. The last category in this section is diurnal melatonin. Notice the first morning melatonin and pooled melatonin levels are elevated. Since two markers were out of range for diurnal melatonin, you get two interpretive comments, one for first morning melatonin and another for pooled melatonin. You also get supportive supplement suggestions here. Next in the report is the super helpful sex hormone flowchart. Starting in the upper left, we can turn pregnenolone into progesterone, which can become beta-pregnenolone or alpha-pregnenolone. This preference for alpha or beta can impact sleep and anxiety levels. We can also turn pregnenolone into DHEA. And DHEA can be made into androgens like DHEAS and testosterone. This section also provides information on 5-alpha dominance. 5-alpha reductase is an enzyme that takes testosterone and converts it into the much more potent DHT, which cannot aromatize into estrogen. Notice the dotted line from testosterone to estradiol, E2. When DHT levels are elevated, this can lead to symptoms like cystic acne, especially along the jaw and chin, hirsutism, female pattern baldness, mood swings such as anger and irritation, and PCOS symptoms. We can also turn DHEA into estrogens. The estrogen section provides additional insights on liver detoxification. By quantifying how much 16-hydroxy-E1, 4-hydroxy-E1, and 2-hydroxy-E1 your patient is making via the cytochrome 3A4, cytochrome 1B1, and cytochrome 1A1 enzymes. These ratios are reported in the upper right-hand corner of the estrogen section. The cytochrome 1A1 pathway creating 2-hydroxy-E1 and methylation products is the least carcinogenic. We really want to dominate this pathway the best we can. In contrast, the cytochrome 1b1 pathway creates 4-hydroxy-E1, which can turn into quinones that can damage DNA. We want to minimize this pathway. It can't be zero, but we want to minimize or at least help support getting off this pathway. Finally, the cytochrome 3a4 pathway is considered proliferative, so we want to encourage 16-OHE1 to turn into estradiol if you're looking to support bone health, but not so much if your patients suffer from proliferative conditions like heavy periods, clots, fibroids, breast tenderness, and breast fullness. I tend to see a lot of preference for this pathway in younger women. One of my favorite parts of the report is the speed dial showing methylation activity. This dial shows how well your patient is turning 2-hydroxy-E1 into 2-methoxy-E1. However, looking at all the estrogen markers, Vibrance Hormone Zoomer includes a total of 4 methoxy metabolites. When you compare the level of the methoxy metabolites to the level of the hydroxy metabolites, it provides insights on methylation status, since you will have fewer methoxy metabolites and more hydroxy metabolites when methylation isn't working properly. On a related note, it also provides insight on phase 1 versus phase 2 estrogen metabolism in the liver, because hydrolysis is a phase 1 functionalization reaction, whereas methylation is a phase 2 conjugation reaction. This is an important concept, so let's explore methylation activity in more detail. Hydroxy or OH metabolites are on the left, and methoxy MEO metabolites are on the right. 2-hydroxy-E2 gets turned into 2-methoxy-E2. 2-hydroxy-E1 gets turned into 2-methoxy-E1. 4-hydroxy-E2 gets turned into 4-methoxy-E2. And 4-hydroxy-E1 gets turned into 4-methoxy-E1. On a related note, the Hormone Zoomer also includes 3-methoxy-2-hydroxy ratios, providing comprehensive insight on methylation activity. When methylation is good, we can assume B12 folate sufficiency. Note that the methylation dial only looks at conversion of the 2-hydroxy-E1 into 2-methoxy-E1 down the cytochrome 1A1 pathway. However, that's not the only pathway impacted by methylation. Sometimes, methylation isn't happening down the cytochrome 1B1 or the 4-OH pathway, which you can see from the other two ratios. Going deeper down the detail rabbit hole, here's another way of looking at it. While methylation of the 2-hydroxy-E1 into 2-methoxy-E1 is in green, methylation of 4-hydroxy-E1 into 4-methoxy-E1 is in the high red, which means most of the 4-hydroxy metabolites are getting made into reactive quinones and likely causing DNA damage. Another way to confirm DNA damage is by looking at the oxidative stress marker 8-OHDG. Briefly, of the nucleotides used to make our DNA, guanine is the most prone to oxidation. When oxidized, the guanine in DNA becomes 8-hydroxy-deoxyguanosine, or 8-OHDG for short. You can think of this as rusty DNA. When your DNA repair enzymes find 8-OHDG, and yes, your body can repair damaged DNA, those repair enzymes replace the rusty 8-OHDG with regular guanine, and the 8-OHDG is excreted in the urine where we can measure it. This person's results show high levels of 8-OHDG at 13.76, indicating this patient has elevated oxidative stress. Again, the summary is followed by interpretive comments for each marker that is out of range, along with supplement suggestions and supportive supplement suggestions. And notice that the more out-of-range markers, the longer this section becomes. The next page shows progesterone metabolites. Progesterone is the feel-good hormone, so lower progesterone in women can lead to symptoms like anxiety, poor sleep, irritability, hair loss, as it supports calming neurotransmitters like GABA. Additionally, low progesterone compared to estrogen can lead to symptoms of estrogen excess like breast tenderness, heavy cycles, and contribute to growth conditions like fibroids and endometriosis, even if estrogen levels are within the normal range. In other words, it's not always high estrogen, but the lack of progesterone causing symptoms. The next part of the report looks at testosterone and metabolites. Testosterone is often considered a Goldilocks hormone, meaning it needs to be just right, not too high and not too low for optimal health. Too little testosterone can lead to symptoms like fatigue, low libido, depression or mood changes, reduced muscle mass and strength, decreased bone density, and cognitive issues. On the other hand, too much testosterone, whether endogenous or from supplementation, can result in irritability or aggression, acne or oily skin, hair loss, elevated red blood cell count, increased cardiovascular risk, and hormonal imbalances, including estrogen dominance from aromatization. Again, the summary includes interpretive comments for each marker that is out of range, along with supportive supplement suggestions. The next part of the report looks at hormone ratios. We already talked about the 3 ratios that provide insight on methylation activity down the cytochrome 1A1 and 1B1 pathway, but I included a summary on this page for convenience. Another ratio worth pointing out is the testosterone to epitestosterone ratio, which can provide insight on anabolic steroid use and the UGT2B17 deletion. For those who don't yet know, UGT2B17 is a gene deletion that impacts the glucuronidation of androgens, particularly testosterone, epitestosterone, DHT, and androsterone. Again, the hormone ratio summary includes interpretive comments for each marker that is out of range, along with supplement suggestions and supportive supplement suggestions. Also note that the oxidative stress marker 8-OHDG appears after the hormone ratios. Another thing worth mentioning is that the results are reported as both a number and plotted graphically, so you can visually see how high or low your patient's results are. In addition to the adrenal and sex hormones and metabolites, the Hormone Zoomer screens for 13 endocrine disrupting chemicals like BPA, phthalates, and parabens. This is the first time you'll see the yellow category on the report. While urinary hormones are either in range or out of range, so either green or red, endocrine disruptors are categorized based on percentile. Results in green correspond to the 0 to 75th percentile and indicates mild exposure. Results in the yellow correspond to the 75th to 95th percentile, indicating moderate exposure. And results in the red correspond to the greater than 95th percentile, indicating that exposure is higher than 95% of the population. For each chemical that is elevated, the report will include a comment explaining common sources and symptoms of toxicity, identify the affected hormones, and explain the mechanism or mechanisms of action. For example, parabens bind to estrogen receptors, imitating estrogen's function and amplifying its effects. This increases breast cell growth, raising concerns about their potential role in breast cancer. The summary also includes supplement suggestions and/or supportive supplement suggestions. Endocrine disruptors can be agonists, mimicking hormone function. Antagonists, blocking hormone function. They can modify receptor expression, affect hormone distribution levels in circulation. Endocrine disruptors can also block hormone signaling directly, or impact hormone transport, affect hormone clearance, interfere with epigenetic modifications of hormone-producing cells, impact hormone synthesis, or alter hormone-producing cells themselves. The Hormone Zoomer also includes 2 bone health markers, DPD and PYD, to assess bone degradation. Basically, high levels of DPD and PYD indicate the rate of bone resorption, thus increased risk for bone loss and a higher risk of osteoporosis and fractures. Monitoring bone health is critical for aging populations, perimenopausal women, and patients on hormone therapy. Again, the report will include interpretive comment and supplement suggestions for each marker that is out of range. For example, this report recommends 1,500 milligrams calcium daily to support bone health. The summary section ends with a summary of all the supplement suggestions organized by category. This eliminates the need to upload results to a third-party analyzer to get supplement suggestions. All the suggestions are included on the report. On a related note, the lab uses a weighted ranking approach for supplement suggestions. The ranking considers both how often a supplement is recommended and its evidence-based rating. This means higher-rated supplements will appear at the top, ensuring that those with a 5-star rating come first, followed by 4-star, 3-star, and so on. This weighted ranking system for supplement suggestions provides helpful evidence-based suggestions for healthcare providers and patients to make informed choices. Finally, the report ends with all markers. One last thing to point out is that all urine tests should measure urine creatinine. This is because urine can have varied concentration. Sometimes it's a pale yellow and sometimes it's orangey brown. Good news, urine creatinine is constant. So all markers are normalized to urine creatinine to account for urine dilution variations. I'd like to share complementary tests, but before I do, I want you to think about Dr. Sydney Baker's TAC rules. Rule number 1, if you're sitting on a TAC, it takes a lot of aspirin to make the pain go away. In other words, it's difficult to heal if you don't identify the root cause of your symptoms. Rule number 2, if you're sitting on 2 TACs, removing one does not necessarily result in a 50% improvement in symptoms. In other words, sometimes there's more than one root cause contributing to your symptoms. In addition to Vibrant's Hormone Zoomer, also consider the Gut Zoomer, which reveals microbiome and estrobolome influences on hormone levels. For example, your patient may be making appropriate amounts of estrogen, but if they have an overgrowth of beta-glucuronidase-producing bacteria, they aren't able to remove those estrogens from the body, resulting in symptoms of estrogen excess. Also, the oxidative stress profile, which includes 15 additional markers of oxidative stress beyond the most common 8-OHDG, so 16 total. Also, the total tox burden to investigate and reduce total toxin burden, not just endocrine disrupting chemicals. This is especially helpful when Hormone Zoomer results indicate blockages in the liver detoxification pathways. Another smart pairing is the saliva hormones test, which assesses bioavailable hormones. This can be particularly helpful for patients utilizing topical hormone therapy or patients presenting with symptoms of sex steroid imbalances or suspected adrenal and/or HPA imbalances. On a related note, dysregulation of the hypothalamic pituitary adrenal or HPA axis is associated with alterations in the serotonergic system, and the neurotransmitters test assesses the serotonergic system. So if your patient's Hormone Zoomer results indicate HPA axis dysregulation, also consider the neurotransmitters test. Vibrant's micronutrient test is another good option as it measures essential vitamins and minerals that play a role in hormone health. Deficiencies can contribute to hormone imbalances, and this test helps tailor nutritional interventions. Finally, if your patients have symptoms of estrogen excess or deficiency, then consider the NutriPro or Methylation panel, both of which reveal genetic polymorphisms that could lead to estrogen metabolism issues such as mutations in the MTHFR and COMT gene. In summary, Vibrant Wellness uses gold standard LCMS-MS and GCMS-MS to measure your patient's adrenal and sex hormones and metabolites, endocrine disruptors, oxidative stress, and bone health markers. Doing this gives you insight on sex steroid hormone imbalances, adrenal HPA axis imbalances, bone health, exposure to endocrine disruptors, as well as DNA damage. All of this allows you to identify the root cause of your patient's hormone-related symptoms and craft personalized protocols to get your patient feeling better fast. To learn more, visit the link in the video description. If you have any questions, please ask them in the comments below this video. Thanks for watching, and I hope you have a vibrant day.